Good evening, everybody.
Hey, Dr. Johnson.
Good evening. Welcome. I'm doing my informal attendance here. Let's see, is Taylor Davis here?
Yep.
Thank you. Welcome. Jessica Deller, are you here?
I am.
Welcome. Claire Dickey, are you here?
I am.
Thank you. Angelica Ford is not here, I know. Maria Dominique Mitra, are you here?
I'm here.
What's up?
Okay. Everyone else I have here. So if I didn't call your name, don't worry. I'm not going to do the if you're not here, raise your hand kind of trick, because it looks like everybody else is here. Awesome. We got 24 students here today. Very good. So tonight we're going to start off with a quiz. We'll cover material. We have 8 different chapters tonight and get you all ready for the exam that is coming up next week. So before that,
Dr. Johnson, it's not letting me.
Me either.
Not letting me in.
I
Not
can't
let me
get on
in.
either.
Yeah,
Yeah, once you hit submit, it doesn't do anything.
I didn't either.
oh no. May have the wrong password. Just a minute.
Yes.
Blank too.
I thumbs up early.
All right. Let me double check. I thought the password was a little too easy. Ah, I know why. Because I changed the password. Okay. The new password that's in chat. It is live25, capital L, lowercase IVE 25. Got it? Okay, try that one. Okay. Very good. See you at 25 past. Okay, welcome back, everybody. Please turn your cameras back on. Okie doke, everybody. Any questions before we proceed? Okay, Lakendra, please turn on your computer. Sherelle, need to see you. Sherelle Brown is in. Can I say that you're in witness protection? No. Okay, I can see your face. You're not in witness protection anymore. Okay, thank you. Very good. And you all know witness protection, right? The kind of you don't see the person, and you probably don't have a voice distortion thing, but we gotta see you in this class. Okay, so remember, for case management, we want to ensure coordination across the continuum. We want to use evidence-based for critical thinking. And we also, case managers, control expenses. Case managers are included in discharging people and how many people were discharged late, and how many extra days they took, and how much we didn't get paid. So care across the continuum, evidence-based care, and we control costs with case managers. 3 things. A lot of these are rule of 3. So 3x5 card, case management, care across the continuum, evidence-based decision-making, and manage resources, control expenses. 3 things you would have on your case management flash card. If you had a family that spoke another language, you would probably get a translator, right? In fact, you would probably get a medical interpreter. So not just translating, but interpreting. I'm sure you all know that case management plans, should they be one size fits all, or should they fit the client?
Fit the client.
Yep. They should be based on the client. They should all be custom. Disaster management. When does planning begin for that?
Before the disaster?
Before? How could you possibly plan before a disaster?
Having a plan in place?
How would you know what disaster to plan for?
I don't know.
I am messing with you, Lakia. You are correct. Before the disaster. Are we pretty sure what disasters could occur? Yeah. Do we all practice fire drills, for example?
Yes.
So we know fires likely to happen. We practice that. And we practice fire drills before there's a real fire, right? And fire drills, when there's a real one, we actually do pretty well because we practice that. So we don't need to know. We know number 1 is going to be like a fire, electrical failure, could be a code blue, could be a tsunami, earthquake. We can practice before they happen. And I have been involved in every one of those, and hurricane, and tornado. When you are doing evaluation, you're evaluating, say, teen pregnancy program, counseling program. When you're doing evaluation, you would evaluate based on credible evidence at the end. What really happened, what didn't happen. Not what a teenage girl said could happen, but what really happened. So credible evidence is part of the evaluation. Remember that. Continuous quality improvement. Does it differ from quality assurance? Yes, it does. So remember, quality assurance focuses on the care of the client or patient. So did we miss a medication, a therapy, those things? That's all quality assurance. Those are like defect inspectors, and they're nurses who just check on those things. Quality improvement is a whole different animal. And we call it continuous quality improvement because we want to improve and then improve on that. That focuses on the system, like what I mentioned before about, okay, there's 5 steps, and I was a quality assurance or quality improvement person before I was a nurse. And I wondered how nurses make so many mistakes on meds or these things. Once I became a nurse, I found out, there's 5 steps to get something out of the Pyxis. That's a problem. Or that things were in the Pyxis, there's a certain drug that's in the refrigerator with the lock, and we do something and turn around 3 times and click a button. Those are all problem prone. So those are systems issues continuous quality improvement people would address. Remember, Healthy People 2030 has one of the goals of providing information about people on the hazards of multiple sex partners. If people have one sex partner or 2, things can spread. During the HIV outbreak and AIDS, we found some people had sex with, 10 people a night at a club. That's how we spread HIV so quickly, multiple sexual partners. So that's a 2030 goal, the risks of multiple sexual partners. Remember, people who abuse others have probably done it in the past. Okay, any questions on those concepts? Okay, so with that, I'm going to jump to like I do every time we're in the program. So we are all the way to week 8. It is getting very close to being over. Hallelujah. I know y'all love the course. Y'all love me. But probably nobody loves it enough to repeat the course with me. And my goal is not to have you repeat the course with me, is to pass this course, to pass your program, pass your NCLEX, become a nurse. So week 8, please check out the announcements. They're given here. The note-taking guide for week 8 is given here in the announcements. If you don't have it or haven't downloaded it, you may want to download the note-taking guide at this time. Also, a surveillance video, which we will cover here in a minute. So just jump to module, see the big picture. We're all the way to week 8. So thank you for turning in your group projects and peer review submissions. It is not the best setup for submitting these. Sorry about that, who had to submit it through email. Yes, I have your peer review submissions. Remember last time I said there are 2 parts in gradebook for this. One part's the group project, which is 20 points. Another column was the peer review submission, which is 0 points. Well, in the group project discussion, the 20 points, 5 of those points are about the peer review. So everything graded is in that first grade. Out of 20 points, both your response and the peer review are in that first grade of 20 points. The second column, it says peer review submission. The maximum points are 0. So if you turned it in, I gave you a 0 for peer review submission. That's the maximum points in that. Those 5 points for peer review are in the group project discussion. So if you did perfect, you have 20 points for your group project in peer review and 0 in your submission. Does that make sense? Any questions on that? Ideally, gradebook would have had the 5 points over in the other area. So people ask me, why do I have 0 points? I think last time I brought up 0 points for peer review is 0 points. If you didn't have it, I contacted you. Any questions on that? So that's the peer review submission. This week are due an NCLEX and CJ Sim. I've gotten some students saying that they got a notice that a week 10 NCLEX was due this week. Week 10 is due in week 10. So if you get something saying week 10 NCLEX is due, please ignore it. Not sure why it only popped up for some people. I double checked and I am not sure why that happened, but your week 10 NCLEX is due in week 10. So next week, what do we have? Next week, week 9, we have exam 3. We have live reviews this week. The live review schedule is out. Let me know if you have questions on that. I give my review Friday at 11 o'clock. So will I give the answers to exam 3 Friday at 11 a.m.? Yes, I will. I will give the answers. It won't be like question 1 is C, those kind of things, but I will cover the key concepts in exam 3, 11 o'clock Friday. So if you would like to attend, that'd be great. I'll also record it. Live is preferred. Also due next week is your vulnerable populations assignment. Let's look at that for a second. Here is what it is. So this is a PowerPoint. Sometimes we'll say paper, but really it's a PowerPoint presentation. It says maximum of 10 slides. You can go more than 10 slides. You can go 12 slides, 14 slides. Keep it under 20 slides, please. I will not penalize you for more slides, but some people go like 10 pages of demographics. That really doesn't help. 1 page of demographics would do it. So you can go more than 10 slides, keep it under 20, please. What group are we looking at? Well, it's up to you. Any of these groups are fine. Or another group if you want. Let me know. I'll approve it. So remember a windshield survey, which is the assignment, includes a survey of a neighborhood. So I would like you to actually go out to the neighborhood. If you don't, you want to do virtual, that's fine too. Please identify the area you are doing a windshield survey for. So don't say Miami, Florida. I don't know what Miami, Florida is. Is that city limits? Is that a county? Is that your idea of Miami? If you want to say zip code 63405, that's great. Miami city limits, that's great. Dade County, that's great. So other people can know what area you are looking at. So make sure you define the boundary. What do you include in your PowerPoint? Well, right there, population. So this should be 1 slide, maybe 2 slides, not 10 slides. Some people go on 10 slides about religion in the area. And then they don't mention religion the whole rest of the presentation. So please try to keep it within 10 to 20 slides. Health risks, promotion and health risks for that group. resources they have, and services that can do that. Service gaps and interventions, primary, secondary, and tertiary. Give examples of those. Do not use AI or some other source for this. I've had people, and I will know if you use AI, because when people do this, some of those interventions pop up, they are completely wrong. And the weird thing is, multiple students have the exact same wrong answer. So please use primary, secondary interventions on your own. Do not use AI. It is wrong. And then a summary to address health risks in promotions. Questions on the assignment for next week? All right, I'm going to jump to one more thing. Bear with me a second here. So something that would really, really help you when you're doing your vulnerable populations, PowerPoint, are resources and services provided. Well, in your county, city, whatever health department you want to use, you will probably have a link where you can get to resources. This is gold. This will answer several things on your presentation. So look up. This is one somebody from Walton Community Health Improvement came up with. Resources that they have. You can see they have many. They worked on addiction treatment, all the different things. So the purpose of this PowerPoint is that you had a client and they asked, how do I get services? You wouldn't say, go to the health department. You would actually give them a list or a phone number or place to go to. This is an example. Any questions? And that's what one would look like. And cite where you got this from. Almost all, and you can always call the health department and say, I'm doing a project, a nursing student doing a project on substance abuse in Miami, Florida. I'm doing a project on homelessness in Cincinnati, Ohio. The department will give you a list of resources or a link. Or you can do it on your own. Okay. Any questions on the vulnerable populations assignment? If you do not turn it in, you'll most likely fail the class with a homework fail. So please turn it in. All right. Let's see here.
Professor Johnson, somebody has their hands.
Say again.
Jamie has his hand raised.
Jamie Garrison, go ahead.
So I emailed you what I want to do, but I kind of put in there like if I can find somebody to interview. But if I can't, I put a second one. Is that what you're wanting us to do before we start the project?
You want to do pregnant adolescents or elderly? Let's not say elderly. Let's just say older adults to be more correct. what agencies take care of them would be the one to look at. So you're not taking care of a pregnant adolescent or an older adult. You're doing the system, how to take care of, what county do you live in, for example?
Clay.
Clay County. So call Clay County Health Department and say, what are resources for pregnant adolescents? Is there a link? Is there a page, something, if I had a pregnant adolescent, on resources available to them? And I would interview the person at the health department. Yeah, that's a good idea. Excellent. Good job, Jamie. Okay. Other questions? And that presentation will be graded via the rubric. So look at the rubric in there and see what, again, people have done like 10 pages of demographics and Catholic and whatever, and done a great job on 1 out of 10 points, but make sure you follow each one in the rubric. Okay. So ethics, and this is from the class 6 and 7 presentation. So you have that in week 7, this PowerPoint. Some things we didn't cover fully last time. Ethical principles. Ethics is one of the chapters we're looking at. So remember, ethical principles of beneficence is minimizing risk while maximizing the benefit. Justice, fair subject selection. Utilitarianism is one where the end has to justify, the action justifies the means. So we can do something unethical for an ethical outcome. Ontology, just the opposite. We have to use ethical methods to get to the result. Distributive justice looks at if we create a burden on a certain group. Consequentialism, based on the consequence of the action. So, feminist ethics advocates for social equity, reduces abstract rules and principles. So, all men are created equal, right? That's our Constitution. Doesn't say women, right? Or black people. That is arbitrary. We just chose that only white men landowners count back when the country was founded. Over the years, we have given rights to people who are not white. We have given rights to people who are women to vote, for example. Those were arbitrary rules that we said black people can't vote, women can't vote, those type of things. People who own property can't vote. Feminist ethics look at that power imbalance, and it's arbitrary between different groups. So most students think they know feminist ethics, and they do not. It does not have, feminist ethics does not have to be male versus female. It can be any imbalance between groups. Please know feminist ethics. That's a big one on the exams and in the NCLEX, I'm sure. Feminist ethics is not just, oh, men discriminating against women. Well, that's this part of it. We got that part, but there's more. Martin Luther King, that was feminist ethics. Why are people of color not equal? Arbitrary. Why? Feminist ethics, believe it or not. So please know feminist ethics. It's much deeper than most people think. Non-malfeasance, doing no harm. So we're not going to try an experimental procedure, or you know what? I saw a different way of putting in an IV. I'm going to try it. We could do harm. We do not do harm. Sharing ethics based on morality and relationships, and know some terms like veracity. So what does veracity mean? Jasmine Flora. Speak with veracity.
Sorry, I was listening for kids causing chaos. I'm explaining veracity.
Mhm.
Truthfulness, accuracy.
Yep, tell the truth.
There we go.
So, Jasmine, is this procedure going to cure me?
100%. I'm just kidding.
You know that for a fact? No. The doctors ordered it. It's the best practice that we do. We do plenty in this facility every day. Those are all truthful. Saying, oh, don't worry, everything's going to be okay. The doctor knows what he's doing. Everything will work out fine. Well, it may not. You do not know. Please speak the truth. Okay, culturally sensitive care. We talked about that a little bit about refugees. Remember, refugees need care because they've left a disaster situation, political situation, and the therapy is number one for refugee care. So, okay, we covered those things. All right, now we're going to have a short video on surveillance.
Hi, and welcome to this quick overview of public health surveillance. We'll take a look at what it is, different types of surveillance, and look at what makes a good surveillance system. Surveillance is defined as the ongoing systematic collection, analysis, interpretation, and dissemination of data regarding a health-related event for use in public health action to reduce morbidity and mortality and to improve health. Historically, surveillance was mainly used to monitor infectious diseases. However, it can be used to monitor any health-related event, such as chronic diseases, injury, health services uptake, vector distribution, or environmental hazards. Surveillance can be thought of as the eyes and ears of public health. The information gained from surveillance can be used for characterizing the patterns of disease, detecting outbreaks, suggesting hypotheses for further investigation, identifying cases for further research, guiding disease control programs, setting public health priorities, or evaluating health programs. Surveillance systems have a few basic elements. First is the way of detecting health events and notifying them. This is usually done by a health service or laboratory. Then the information needs to be collected and stored in a systematic way. This data then needs to be analyzed and interpreted. And finally, this information has to reach the right people so that appropriate action can be taken. So now, let's have a look at a few different types of surveillance. Passive surveillance describes the routine reporting of health data. Let's have a look at some examples. In most countries, there are a number of diseases or conditions that are required to be notified by law. Surveillance of these notifiable diseases rely mostly on a passive system.
So we do have reportable diseases in every jurisdiction, whether it's a county, state, sometimes city.
Another example is a registry, which is a collection of health data. Registries can have data on births, deaths, cancer, chronic diseases, and a variety of other diseases. Healthcare providers like hospitals also routinely collect data on the number and type of patients that seek treatment. This is another example of passive surveillance. Passive surveillance is a valuable source of health information. One of the biggest advantages of this type of surveillance is that it's generally inexpensive. It can be used to provide baseline data on the health of a population, monitor trends, or monitor the impact of an intervention.
So all of these are passive surveillance.
Also, different types of these data sets can be linked to provide a complete picture of health. There are, however, a number of limitations of passive surveillance. The main one is underreporting. Diseases can be underreported because people have mild or asymptomatic illness and don't seek medical treatment for their illness, or there's a lack of access to treatment. It could also be because laboratory facilities needed to diagnose a disease are not adequate, or that there are logistical problems with reporting disease. In fact, there can be a lot of variation in passive surveillance systems from country to country,
So I was infection control nurse for a couple different places during COVID. I got to report all kind of things, and we reported them to another place and 3 places and 5 places. And every week, everything would have to be reported. The newspapers in the early days of COVID said, "Oh, there seems to be a increase in outbreak on," I think it was like Wednesdays. Well, we all reported the data on Wednesday for the previous week.
is a reflection of social, economic, cultural, and epidemiological factors. Now, let's take a look at active surveillance. In contrast to passive surveillance, in active surveillance, health data is actively sought out. This type of surveillance is commonly used during outbreaks. For example, during an outbreak, health teams may visit the community to actively seek out cases that may not.
So remember, an outbreak is well above normal, the amount of expected cases.
Otherwise presented to health centers. Another example of active surveillance is serosurveillance. This involves testing blood in a selected population for various markers. For example, checking for antibodies can be used to check for active or past disease. Health surveys are also a good example of actively seeking out health information. Surveys can be done on community members, healthcare facilities,
Member surveys, secondary prevention, right?
or entire countries. They can be done on an as-needed basis or regularly. Active surveillance provides more complete and better quality data, but is more resource intensive. Another type of surveillance is sentinel surveillance. This type of surveillance uses selected institutions or groups to provide health data on specific diseases or conditions. It can be useful for monitoring diseases, trends, and detecting outbreaks. A disadvantage of sentinel surveillance is that because it's restricted to a few institutions or groups, it cannot detect events that happen outside these. Therefore, it's not that useful for rare or uncommon diseases. Another form of surveillance that's becoming increasingly useful in today's interconnected world is rumor surveillance. This type of surveillance relies on unofficial sources of information like blogs, internet discussion groups, media, hearsay, and social media sites. Rumor surveillance can alert public health authorities to incidents or events that require further investigation and can lead to early detection of disease outbreaks. The next type of surveillance is syndromic surveillance. This involves monitoring non-specific syndromes like presentations for fever, respiratory or gastrointestinal illness, or other indicators that might highlight illness, like the purchases of medicine or absenteeism from work or school. The aim of this is to allow early identification of clusters of illness before diagnoses are confirmed and reported to public health agencies. Syndromic surveillance usually relies on automated electronic methods. There are other types of surveillance systems as well. For example, ProMed is a website that puts together reports of disease events, and the Global Public Health Intelligence Network is an internet-based early warning tool that uses an automated process to monitor online news sources for diseases or significant health events. While there are many different surveillance types, each with its own advantages and disadvantages, an integrative approach using all sources of information provides the best overall picture of health. Okay, now we've had a look at different types of surveillance systems. Let's have a quick look at what makes a good surveillance system. Firstly, a good surveillance system must have clearly stated objectives and have a good system to ensure that these objectives are achieved. Other characteristics include simplicity. It should be easy to operate and have straightforward case definitions that are easy to apply. It should be flexible to accommodate changes in information needs or conditions in which it operates with minimal additional resources. The data should be complete and accurate and be of good quality. It should be accepted by people and organizations participating in surveillance. It needs to have a good sensitivity and positive predictive value. It should pick up most, if not all, cases of the disease that exists in the population. Surveillance data should be valid, meaning that it measures what it intends to measure. The system must accurately represent the occurrence of a health event in the population that is being studied with regards to time, place, and person. It must detect health events in a timely manner so that authorities can take appropriate action. The resources involved in running the system, both human and material, must be stable and available when needed. It's also important that surveillance systems are evaluated routinely to make sure that they continue to meet their objectives and that they're serving a useful public health function. And finally, surveillance isn't just about monitoring health events, but providing useful information to enable public health action. So that's an overview of public health surveillance.
Okay, any questions on the presentation? So you're gonna have to know active versus passive, for example. How do you get the data? Is it active data or passive data? All right, so we're going to jump to, so we have 8 chapters this lesson. Going to go over a little bit on one and let you do group exercise as well. So all the PowerPoints for the readings are in the module. Chapter 6, we'll go over some of the high points from that about ethics. So in a nutshell, ethics, what we believe as a society is right or wrong. Morals, what you believe is right and wrong. We have a long history of bioethics, starting with the Hippocratic Oath, the Nightingale Pledge. Some of you know the Nuremberg Code. We also have a code of professional ethics for nurses. In 79, we had the Belmont Report, which talked about experimentation on human subjects. Let's see. Ethical frameworks are given there. A lot about the code of ethics is given there as well. Remember, as nurses, we are advocates. We practice advocacy, which is acting on behalf of others. So I'm going to stop there. All right, so we're going to do group exercise, going to have you into 4 groups. Each group is going to do 1 or more chapters. I'm going to try to bring up the right thing here. From our note-taking guide. So the note-taking guide is in the announcements. So please download that if you haven't already. I'll divide you into different groups. One group is going to do chapters 6 and 7, complete the note-taking guide. One group will do 15 and 16. One group will do chapter 17, 1, 18, and 19. So group 1 will do 6 and 7. Group 2 will do 15 and 16. Group 3 will do 17. Group 4 will do 18 and 19. I'll drop into the groups and I'll jump in there and remind you of what you're working on. Pick a spokesperson and be prepared to present. Give you about 10 minutes. Here we go. Okay, welcome back, everybody. Let's start off with the first group, chapter 6. So everybody, I would recommend that you bring up a Word document with the note-taking guide with the blanks and fill it in as we go. There's no do-over. Okay. Chapter 6. Number 1, ethical principles of beneficence.
Doing
Is
good.
what? Doing good. So doing good and no malfeasance.
Do no harm.
Do no harm. Again, you should be writing or typing this in right now. Can be traced back to the Hippocratic Oath for health professionals and provides framework for a patient. Clinical relationship, page 104. The next one, blank are human dilemmas.
Ethical dilemma.
Ethical dilemmas. So ethical, remember I said what's we think is right and wrong. So, I'll get to who has a nice car here? Who has a very nice car? Anybody?
I have a Maserati.
I'm about to say Tasha.
You know, I would like a Lamborghini. If anybody wins a lottery, Lamborghini. I love that. I think a 16 valve, the noise, man, they're awesome. Anyways, so if you have a Maserati or Lamborghini, it's ethically wrong to leave that thing without a nice wash and wax job, right? You don't leave it dirty out in your driveway, do you? Ethically, to some people, some societies, that's wrong to leave it unshined. Other people, not a big deal. And there are much smaller ethical dilemmas. So ethical dilemmas are when one group thinks it's okay to live with it and one group thinks it's not okay. Question 3, blank ethics is pertinent to public health. Question 3, feminist. Answer question 3, feminist. Recognizes the role. Is it always female, male? No.
No.
Any power imbalance, especially ones that are arbitrary. After the Civil War, our country said we passed a constitutional amendment where people who are black could vote. Wait a minute, not all black people, just the males. Wasn't until about 1920 when we said, okay, females can vote as well, white or black. And then other treatment, even though we had it in law, maybe wasn't in place until later. Chapter 7, culture of populations in communities. Question 1, blank is a set of beliefs or values or assumptions.
Culture.
Culture. Question 2, blank is a biological variation.
Race.
They're on his bed.
And race is
That's what he's trying to tell you to do.
biological variation is DNA.
He said you own it.
Bridget, mute.
Oh,
Yeah, make sure you mute if you're on. Okay, question 3, in blank culture, time is viewed as being flexible.
Future oriented.
Past oriented.
It's past oriented.
Past oriented culture. Nurses should
Are you
notify
saying pest or past?
PAST.
Oh, past. Okay. Okay.
And also question 3, nurses should identify the client's perceptions to avoid misunderstanding. It is not realistic to expect clients to change behavior and adopt the nurse's schedule. Got that? We got 3. Okay, question 4. Blank are circumstances.
Social detriments of health.
Social determinants of health.
Determinants.
Social determinants of health. Question 4. Very good. Question 5. 4 categories of foreign born. Most people think are legal, illegal, whatever. No, there's at least 4 categories. There's probably more. I'll just list them off. Question A, documented immigrants are known as lawful permanent residents. B, refugees, persons seeking asylum, refugees for B. C, non-immigrants are people admitted for a limited duration. Question D, undocumented immigrants are undocumented or what we call illegal aliens, don't have documentation. Any questions on 5? Oh, also, even though non-citizens are likely citizens to work, they may not have health coverage for employees. Health coverage is the answer to D. Questions on that? Moving on to chapter 15, case management. Who had group 2? What's the answer to question 1?
I don't have everything for 15, so somebody can read it and I'll do 16.
I have 15. The first link is implemented with individual clients in the system.
Individual. And then the next part?
Is managing the transition.
Managing the transition. Question 1. Very good. Question 2. We'll just read them off. I'll just read them off because there's a bunch of them. Promote quality services. Reduce institutional care. Manage resource. And control expenses.
What was the one before managed resource?
So question 2, promote quality services, reduce institutional care, manage resource, and control expenses. If you can recite these, you're going to be really good. Questions on 15. $16. So who has question 1 for 16? Disaster management includes 4 stages. What are they?
They are preparedness, response, and recovery.
There are 4 stages. You listed 3.
Prevention. I'm sorry, prevention.
So 4 stages are prevention,
Preparedness, response, and recovery.
Response and recovery. Very good. Page 209. Question 2. All hazards in emergency management, reducing risks for national hazards. Blank.
And technological hazards.
Actually, the way it's written is all hazards mitigation prevention is an emergency management term for reducing risks to people and property from natural hazards before they occur. So the fill in the blank for 2 is before they occur. Goes back to our quiz question. Okay, question 3. I'm gonna kind of read it off because there's a bunch of parts to it. Get a kit. How many days of non-perishable food and water?
3-day supply.
3 days. I saw one hurricane in Florida. An hour after the hurricane hit, people demanded water. That's not 3 days, that's 1 hour. 3 days, food and water per person and or animal. Battery powered or hand crank radio. A flashlight and extra batteries. A first aid kit. Medications, that's the fill-in, medications and medical items. And then 4 copies of all important documents. Any questions on that one? On get a kit. Make a plan. Choose a contact person out of the area. Tell everyone in the household. What's your answer?
Where the emergency supplies are kept.
Yes, because the dad knows where they are, the mom knows where they are. Everybody needs to know where they are. Practice evacuating your home twice a year. And then don't forget your pets. That goes without saying. They will let you know. Okay, number 4. I will just list the fill in the blanks because there's a bunch of them. List of allergies and physician names. Allergies and physician. The next fill in the blank for question 4. Toilet paper. That's a soap, feminine hygiene, etc. The next fill in the blank. Special items for infants, etc. Extra pair of eyeglasses is the next one. And the last fill in the blank for number 4 is waterproof container. Why? If there's a flood, whatever, hurricane, tornado. Question number 5. Post emergency phone numbers. Teach everyone how to call 911. Teach everyone how to turn off water, gas, electricity. Check adequacy of insurance coverage. Actually, that would be probably later. Locate and review fire extinguishers. Install and maintain smoke detectors. Conduct a home hazard hunt for potential hazards. Stock emergency supplies in a disaster supplies kit. The next one, acquire first aid and CPR certification. You all have that. The next answer, locate all escape routes from your home, escape routes from your home. And the last one for question 5, find safe spots in your home for each type of disaster. Questions on that one?
Yes.
Yes,
Could you go over could you go over number 5 again? The fill in the blanks. I got some and I missed some. I'm typing.
There you go. It's in chat.
Thank you.
Okay, chapter 17. Almost done. So who has chapter 17?
I do, Dr. Johnson, my group and I.
Okay, so question 1.
Disease surveillance.
Excellent. Disease surveillance. Ongoing systematic collection to
Monitor disease trends.
Monitor disease trends. To
reduce morbidity and mortality.
Morbidity and mortality. Excellent. Purposes of surveillance, page 306. And again, if you don't get these all, look at the recording or look at the page number.
Do you want me to just fire off the fill-ins or
Yes, go ahead.
assess public health status, respond to unusual disease spread and terrorism, define public health priorities, plan public health programs, evaluate programs, stimulate research, and improve health.
Excellent. You got them all. Perfect. So question 3. Surveillance systems in use today, passive, active, sentinel, and special.
Passive system,
Passive system, then B is
active system,
active system, C is
sentinel,
excellent, and D is
special.
right,
And the last one on the blank is a combination.
which are used in combination. Very good. So finally, question 4, patterns of occurrence can be identified when investigating a blank outbreak.
Mix.
Common source.
Common, so no common and point source. So point source is what? All persons exposed at the same time during one incubation period. Also know what a mixed outbreak is. Mixed outbreak. Think of the church picnic, the restaurant where people get sick. That's a mixed
And a
outbreak.
victim of a common source.
So know what mixed source is as well. Chapter 18. Who had that? Group 4, I think.
Program management.
Program management. Question 1, chapter 18. Assessing, planning, implementing, and evaluating. Very good. Question 2, the initial most critical step in health program planning is
Defining the problem and assessing client needs.
defining the problem. Assessing client need. Very good. Questions on 18. Okay, finally, up to 19. Do you want to take a shot at question 1? Health services applies to wide range, including question 1, access, the question of access to appropriate resources. The next one on question 1, a well-prepared workforce. Question.
We had competent, is that fine?
Yep. Same idea. What are the last 3?
Improvements in the status of the population's health.
Improvement. I agree. Yep.
Social and economic well-being.
I would say client satisfaction and well-being.
And then the quality of client-provider interaction.
I would say the processes of client-provider interaction. Your answers are not incorrect, though. Goals of QI, I'll go over this, timely, effective, and safe. Question 2, timely, effective, and safe. The next question, optimize internal resources to improve the health of the community. Okay, chapter 28. Nurses, either individually or through groups, can work to influence what? Chapter 28. Or nobody in chapter 28. That's probably why. I dropped it in the chat. So nurses can help through policy and legislation. And check and chat. They can also mobilize neighborhoods, work with a thing called a coalition or network to change practices and policies. So those are in chat as well. So Thank you for participating in that. What are your questions? That is so again, don't forget live review. Mine is Friday at 11. There's others. Check the schedule. Let me know if you have any questions on those. I can meet with you one-on-one as well. Next week, we will check in, make sure you have your whiteboard, ID, computer with space on it. Please free up space on your computer.
Dr. Johnson, I don't know about Orange Park, but I know the Fortis in Norfolk, like literally everybody's been having a problem with Exemplify. Literally everybody in like the class yesterday when we was in school, they couldn't even get into it. I still can't get in my Exemplify now, but I'm gonna try to get it worked out.
Okay. Well, we may have a practice exam, an extra practice exam before exam 3. We will see if we need that. So if I have that, please
That
make sure
probably
your
would be
computer works.
beneficial for at least for the Norfolk location because
Okay.
we've been having a lot of problems.
Well, thanks for that information. Again, I'll let you know if you have to have a practice exam or something to make sure your computer works. Next time we will do week 9, exam 3 only after that. And also your vulnerable populations paper is due the end of next week. So if you're worried about the exam and you just want to focus on that and then worry about your presentation after and have questions, get a hold of me at that point.
Okay. Thank you.
But thanks for letting me know about that.
So what will we do? Because I'm having problems with Exemplify as well. So what will we do if we can't get in?
I will make sure that you have a practice exam and it works beforehand. And the practice exam will not be the exam, it'll just be, select all, whatever. Make sure your computer works for it. Also, delete your old exams off your computer to free up space if you need to. Any questions? That's all we have for the class. If you want to stay over, I am staying over. Otherwise, I'll see you next week. Thank you.
Thank you.
Goodbye, everybody.